Okay, so we are rolling, literally and figuratively. We're rolling into stinking education week. We talked about discipline. We talked about stinking motivation. Then we had disciplined motivation. And now we're rocking and rolling with education week. Formerly, we termed this nutrition week because there's just so much to do with healthy living that revolves around what we eat, where we shop, how we prepare our foods, the frequency at which we consume our meals, what to drink, at what intervals. So we're gonna talk about all those things this week. However, one thing that I want to squeeze in is anatomy and physiology, because it's very, very important and it's very interesting. And I think that if you're going to know something about something in this rather short life, it'd be cool if you knew about your own human being. So anatomy is the link of form and function. In other words, the skeleton, the muscles that pull on a skeleton. From a microscopic to a macroscopic level, what is happening? What is it about the shape of this bone that makes it function as a toe? What is it about the course of this tendon and its attachment that allows for mechanical advantage so you don't fall on your friggin' face? We're going to talk about that. We'll talk first about the foot, because it is where the rubber meets the stinking road. So here it goes. We've got the toes. The toes are numbered 1, 2, 3, 4, 5 from the big toe. Big toe is number 1. Also called the hallux. Can you say hallux? Okay. This is the hallux. The toes are called the phalanges. All right? And all these little bones that are connecting to one another, those are the phalanges. Proximal to that, or closer to the ankle, we've got these larger long bones that are linked up with the 5 rays, as we call them, the 5 rays, and they are called the metatarsals. All right? They are analogous to your hand. Between your fingers and your wrist are the metacarpals. So we're talking about the metatarsals. So here we go. 1, 2, 3, 4, 5. And then closer to the ankle and essentially comprising the ankle are the tarsals. Now they're, for the most part, obscured by this tan, brownish pink soft tissue simulation here, which are the so many tendons, muscles, ligaments, blood vessels, and nerves that work on and around the foot and ankle. So to review, the phalanges, the metatarsals, the tarsals. And we've got 2 bones here. We've got the main bone is the shin bone, right? And that is called the tibia. And then lateral to that, or on the outside of your lower leg, is called the fibula. And this goes all the way, stretches all the way from at the top near your knee, all the way down to a little bump here that you can actually see. I take my rather large sausage finger out of the way. It is called the lateral malleolus. And the lateral malleolus is a little bump that everybody can feel on the outside of your ankle. It is an attachment point for tendons and ligaments mostly. Clinically, the most common injury that we ever sustain in Dr. Drill is an inversion sprain, where essentially somebody plants and goes like that and drops this piece over. Maybe when you're falling off, running along a sidewalk in 0 visibility, and your foot falls off between the grass and the concrete. Happens every time. So the inversion sprain. Inversion sprain happens between the lateral malleolus and forward, a little ligament that attaches just like such, that is called the anterior talofibular ligament. All right. So that is a very important soft tissue structure that is oftentimes sprained. A sprain is a tear of a tendon or a ligament, as opposed to a muscle, which would be a strain. Yes, yes, yes. Okay. So we've talked about the phalanges and the metatarsals and the tarsals and the tibia and the fibula and the tendons and ligaments. By the way, most of which you can see very clearly right here on the top, these rather long string-like structures that are going down to the feet, the toes. They don't necessarily stop there. They can go all the way down to the tippy of the toes so that we can pick our toes up just like a stinking marionette. On the front of the ankle is a unique structure called the retinaculum. And it's like a little band that acts as a retainer for these tendons. It holds them down and just kind of keeps the wrist, the ankle rather, compressed. That's called a retinaculum. On the rear of the ankle and foot, we've got the Achilles tendon, which starts at the large calf muscles, the gastrocnemius and the soleus of the lower leg, and then a continuation of that muscle eventually turns into a tendon and attaches right on the back of your heel. A big bone, which you should know, your heel bone, is called your calcaneus, and that's right there. All right, your calcaneus or your heel bone is the attachment site for the Achilles tendon. Very, very important tendon, one of the largest in the body. If you snap this or irritate it, it's going to be angry. Note that around, coursing the length of a tendon, there's a sheath. It's like a little jacket that covers up the tendon, the Achilles tendon or any tendon. And you can think of the tendon and its sheath as a cylinder in an engine. And you know the old, your typical automobile oil commercial will have some sort of NASCAR car screaming around a racetrack, and then because it has the wrong oil in the engine between the cylinder and the piston, it seizes up, so breakdown. So same thing happens with the Achilles tendon and its sheath. It's got a small quantity of, actually not a small quantity, an unlimited quantity of what's called synovial fluid between the tendon and its sheath, acts as a lubrication, acts as the oil, and prevents breakdown. However, if you injure the foot or if you're mechanically screwed up, you can increase the friction between the tendon and the sheath and cause breakdown, and then you get tendonitis. And that's not fun. Hurts like hell. So, on the inside of the foot, we've got something called the arch. The arch is otherwise known scientifically as the medial longitudinal arch. It acts as a leaf spring, okay, on a car. If you can ever seen the rear end of a car, the bowels of it, it's got these kind of like spring, like half-moon spring, steel spring devices on the back. And that is essentially a leaf spring. Same thing happens with the medial longitudinal arch. The spring is about, dampening the forces. So with every step forward, that spring, see between my thumb and forefinger, that is a spring action. Every time you take a step and hit the ground with a portion of your body weight, the ground hits you back. It's purely physics we're talking about here. And so if you have a nice medial longitudinal arch, then you're in good shape. And if you have flat feet, you're in bad shape, because all of the, if you can imagine all the machinations, the biomechanics of the human body as the heel hits the surface of the ground, and then the toe hits, and then the ankle hits, and then the knee hits, and then the hip hits, and then all those forces are absorbed by the low back. If you can imagine how the foot bone is connected to the ankle bone to the knee bone without a spring in that arch, then bad things are going to happen. You understand that? Good. Okay. Hence, that's a foot. We're going to do a quick review here. You're going to say it, as I pointed out. All right, so the toes are called what? They're called the phalanges. The first toe is called the what? The hallux. The hallux is the big toe. Of note is that all the biomechanical forces and all the energy from the big butt, thigh, leg muscles are focused right to the tippy toe of your big toe. Okay? And if somebody with a key comes into my office, Barbara Surrey, I am not going to stop, and she's not going to make a peep, because I'm trying to do this video, and I'm going to finish it. You hear me, Barb Surrey?
Yes, sir.
All right, Barb Surrey's not going to impede my progress with this, because we're coming up to a close. The hallux, or the big toe, okay, is very, very important biomechanically, because it is the focus of all of your body's energy hitting the ground. It propels you forward. All right. Phalanges, metatarsals. The ankle is comprised of what? The tarsals, a jigsaw puzzle of larger bones meeting together. The big shin bone is called what? The tibia. The bone on the outside of the lower leg is called what? The fibula. The end of that bone is called the lateral what? Lateral malleolus. The anterior talofibular ligament is the ligament that is oftentimes sprained when one rolls their ankle. This tendon on the back of the attaching the gastrocnemius and the soleus to the what bone, the heel bone, the calcaneus, is called the Achilles tendon. If I hear you call it the Heelys tendon, I'm going to have a big problem with you because you're going to sound like a dumbass. Okay? Nobody in my platoon is going to call it the Heelys tendon. Good. All right, and there's your anatomy lesson. Anatomy lesson number 1. Where the rubber meets the stinking road, the foot, the ankle. It's very, very important that you know your anatomy, at least a little bit, so you don't get yourselves in trouble out there. You understand that? Education Week is hereby begun.